All right, good afternoon. This is our 5 p.m. update on the coronavirus in Kentucky. Again, the most important thing that we take away from this is that we must remain calm as a state. We will have days where testing comes in differently than other days, but we know that as we move forward, we will see more tests here in Kentucky. We're ready for this. We can take this on as a state. We will come out on the other side. So the news out of the World Health Organization today is that they have declared this a pandemic. And the biggest concern from the World Health Organization is what they called alarming levels of inaction. And so as we talk through all of the steps that we have taken to date, our goal is to be taking action to ensure that we can address this virus, that we can protect the most vulnerable here in Kentucky. This afternoon's update is pretty good news. We had 11 cases, 0 positives today. We had 10 negatives and 1 inconclusive. Now, we will have more positive tests as we move forward, but that is pretty good news for today's tests. Some more good news, the Jefferson County resident that had been isolated in the hospital is in good condition, and now he has been discharged and is isolated at home. That's really positive news. And let me give Norton's Brownsboro some credit here. They treated him like any other patient, but with all of the extra precautions. I'm told the family never felt isolated. That is exactly how we have to respond to our neighbors that ultimately have this coronavirus. I'm proud of the way that they and our other hospitals and others are responding. The most recent news we have is that everybody is in stable condition, and we actually hope here in the next couple days that one of our Harrison County residents will be fully out of the woods, no longer infectious, and we are looking forward to the day that happens, and I know that that individual and their family is too. The next month is going to be critical. That's what all of the national health experts are saying, and how we respond to this in the next month, I believe, is going to determine how long we are dealing with it, but also how severe the impacts of the coronavirus are going to be here in Kentucky. My job is to take the necessary steps to protect the most vulnerable, especially our seniors and those with underlying health conditions. Again, those are heart, lung, and kidney disease, especially in kidney disease, those with diabetes need to understand that they are vulnerable and take the steps to protect themselves. Going through the steps that we have taken or recommended thus far, we declared a state of emergency that gives us all the tools that we need and access to funding where we need it. Second, we activated the State Health Operations Center, or the SHOC Center, and the Emergency Management Operations Center. We have been in contact with all 120 county judges to give them an update and to discuss the emergency management network that we can use. I'm thankful today I didn't have to call any county judges to tell them about positive tests in their county. I've been doing that personally. I'm going to continue to do that personally because the leadership we're seeing from our mayors and our county judges is so critical, and thus far absolutely everybody has stepped up and is providing the type of leadership we need. We initiated the changes to Medicaid and filed an executive order with private insurance to try to ensure that cost is not going to be a barrier, especially when tests become commercially available. We issued an executive order to prohibit price gouging. And today, in a minute, we're going to talk about, if you can't find disinfectant for your home, how you can create a water bleach solution, because I think just about everybody has one of these bottles underneath their sink or somewhere, hopefully locked from young kids, where you can have the disinfectant that you need. Our website, absolutely critical. We are seeing more traffic at it. This is the source in Kentucky for information from this administration. It is kentuckycovid19.ky.gov. That is KYCOVID19.ky.gov. It's going to update here in just a minute with the number of cases, the number of positives. It has all of the guidance that we have issued, so the guidance on prisons from this morning is up there right now. We need as many people possible to go to it. Most of the questions that we get, we're able to refer people to very specific guidance. So please, in every story that you do as the media, make sure you repeat this website. It is the best source for information. We also have our coronavirus hotline up. That's 1-800-722-5725, 1-800-722-5725. And we've put out the type of infographic about when to use the hotline. Again, it's important that we do not overwhelm our healthcare system, that it is available for those that are truly sick. And at a time when people get nervous or have fear, there can be a run on our healthcare system. We can't let that happen. So if you are sick, if you are well but nervous, call the hotline. Don't go to a medical facility. Don't go to a healthcare facility. If you are sick but wouldn't otherwise normally get medical attention, think about coughs, colds, allergies, because it is allergy season. Call the hotline. Again, if you're nervous, do not overwhelm our healthcare facilities. But if you are truly sick and you would have gotten medical attention and or you have an injury, make sure you go to a healthcare facility or to a professional. I continue to use my son as an example. I hope he doesn't mind when he gets older. Broke a finger this Sunday, needed to go to a facility, and he did. In the elbow. We have published CDC guidelines with warnings. Those include, and these are still critically important, that if individuals over 60 or who fall in what are a vulnerable population need to avoid large crowds. For those vulnerable populations, do not fly, do not get on a cruise ship. We provided strong guidance advising nursing homes and long-term facilities to at least temporarily close to visitors. It's my job to make sure what happened in Seattle does not happen here, and it's tough. I'm getting personal texts and personal emails, most of them positive, but of people who really want to see a loved one, and I get it. But right now, we have to protect the lives and the health of those most vulnerable, so we ask for everybody's understanding as we move through this. My goal is that those loved ones in those facilities are around for years to come to make sure they can share the experiences with your family. We signed an executive order that allows pharmacists to refill prescriptions up to 30 days, and we can stage pharmacies if we need to in areas other than the brick and mortar pharmacy. We issued guidance from our personnel cabinet for state employees, ensuring that we have the leave that everybody needs here in state government. As you can tell, we are making changes here in the Capitol. We want to make sure we are modeling the type of social distancing, moving chairs a little further away. We closed down the seating area in the cafeteria, encouraging people to eat at their desks. The type of things that we know can at least limit the spread of the virus. We have instructed school districts now to be prepared to close on short notice should we need to give that recommendation as short as 72 hours. We had a call with our superintendents today. They had a lot of really good questions, and for many of them we had answers, and the rest we're going to work through because we are moving fast. A number of other states or areas have had to cancel school. We ought to be prepared for it as we move here into the future, and if we need to do it, we're going to need to do it very quickly. We've closed all of our state prisons to visitors. Again, a tough step because it's one of the most important things to both those inside and those outside, but in a densely populated small area, we need to make sure that we are protecting both our corrections officers and those prisoners. We've encouraged every individual in Kentucky, in particular, those over 60 and those with chronic medical conditions, to avoid large gatherings and minimize times in groups in public spaces. I just saw that the NCAA is apparently going to play their games for this tournament without fans. That should show you how important this guidance is, how serious that it is, but also that if we do the right things, that we will keep not only we will protect ourselves, because we have two duties. To try to protect ourselves and our families for not getting the coronavirus, but also not spreading the coronavirus, especially to those that are the most vulnerable. I canceled tomorrow's prayer breakfast. It's out of an abundance of caution, but just like the NCAA is doing, I have an obligation, I believe, to lead by example. We have asked for community gatherings, and it is broader than just houses of worship, which I'll talk about in a minute. But we have asked for all community gatherings to be canceled or postponed or done virtually at this time. I know it is a big step, but I can tell you that the direct connection between at least two of the Harrison County residents is that they go to church together. We would not be suggesting that we at least postpone, alter, or do either services or other meetings virtually if we did not believe that this coronavirus can be or is currently being spread in those areas. Let me say that I'm a deacon in my own church. My kids have handbells and choir every Wednesday night. We go every Sunday. It is a very important part of our lives. I don't take this recommendation lightly, and I'm an elected official. I know that it's not the type of thing that's popular, but these times require the courage to do the things that are going to protect those that are the most vulnerable. And as I've served communion in my church, and I look out through that church, at least a third of it falls into the most vulnerable population. Those are people I love and people I care about, and they're people that I want to protect. I know that there are some churches that aren't going to take that recommendation, and that is up to them. What I would ask is if you don't, and we still recommend that you do, practice the type of social distancing, take different guidance from our websites, and go through your worship and think about all the different things that you can do to at least lessen the possibility of the coronavirus spreading. But again, our recommendation is do it virtually. If you're in a small town, maybe call the radio station and see if they'll broadcast it. Find different ways to reach your parishioners so that they can still have that critical worship service. But if you're willing, try to not ultimately crowd people together where we know it can be spread. I said it this morning, my faith teaches me that God gives us wisdom to do the right things. And let me tell the people of Kentucky that I don't believe whether they go to church this weekend is a test of faith. I hope that they also believe that God gives us wisdom to make the best decisions that we can. We suspended out-of-state travel for our state employees. We are making those same type of recommendations to businesses and others. And I've asked people to spread out in meetings and workplaces by increasing the distance between them and engaging in social distancing. It's very important. Every workplace ought to go to our website, ought to get that guidance, and then ought to practice that. And I've urged any business where people can telecommute and telework to go ahead and start doing so. Also encouraged paid sick leave. Very important to not have someone who is sick come to work because of the pressure of not having it. So in a minute we'll show the cleaner, but let me first ask Dr. Stack to come up and give a little bit of his thoughts on where we are right now.
Thank you, Governor, and thank you for being here tonight. The steps we've taken today are not taken lightly, and I think it's important for people to know that. They're made with a very sobering evaluation of the evidence we have, the best knowledge that we have, which is admittedly imperfect. I think that there is a concern that the lessons we've learned from other places in the world give great cause for us to be very aggressive in what we can do to try to prevent the spread of this disease. It's a privilege to be your public health commissioner and to serve with Governor Beshear. I'm very grateful to him for being as proactive as he has been in this time. One of the things we know about the efforts that we're doing now is they're very disruptive, and we don't recommend that lightly. We know that there are few things more important than visiting with your loved ones in a long-term care facility. If you are in a prison, that your connectedness with your family and your friends and your relatives is one of the most important things for you. And certainly for people of faith, that going to church is of particular importance. And so these recommendations are made with great care and great concern for the impact they have on people. The governor said he's a deacon in his parish. I'm educated, Catholic education all the way through college, and go to Christ the King Parish in Lexington, Kentucky. These are not recommendations we make lightly. I want to thank everybody. This has stressed everybody. This has been a difficult time. It's been a wonderful showing of how the community comes together. I have been thoroughly impressed by the healthcare community, the business leaders, the prison leaders, the leaders in educational institutions, and the health department leaders who have come together. But it has stressed everybody in the sense that the pace is moving so quickly that people are getting information and participating in the process in a very, very rapid pace. I want to have everyone hear from me how much I'm grateful to you. I've reached out to as many people as I can. I've seen the governor himself doing that, and the secretary. I couldn't ask for a better partner and boss in this. He has been wonderful as we've tried to reach out to as many people as possible. And if we've not gotten to you, it's not for lack of desire to do so. It's just that our attention has to be on trying to organize the team and respond on your behalf. So I would like to thank the governor again very much. I think his leadership has been absolutely wonderful for the state. And I hope this is an opportunity where Kentucky is a leader in showing the rest of the country how we can have a brisk response and hopefully minimize as much as possible the impact this disease has on our communities and our families. So thank you, Governor.
Thank you. Dr. Stack has been doing great work. We also owe thanks to all the employees of the Department of Health that are working around the clock, as well as those in our local communities. I say it every time. I also want to point out the great job that especially those in Harrison County are doing. They are a model to how to respond with calmness to situations like this. I also want to thank the media for continuing to get the word out about practicing really good hygiene, washing your hands much more than you normally would, washing them with soap and water for at least 20 seconds. Hand sanitizer is good. I know that it's running low in places. It's not as good as washing your hands. So if you have soap and water available to you but are worried about hand sanitizer, go ahead and keep washing your hands. It's even better. But wanted to go over one thing today that we've been talking about because it may be hard right now to find different cleaners at the stores close to people. Want to show an example. Come on up. This is Andrea, and is it Flincham?
Yes, sir.
Who is at CHFS in the Department of Health. She's our manager, Healthcare Associated Infection Prevention Program. And she is going to show us how, with just bleach and water, that we can make an effective cleaner for all of those that are washing at home. So first, we start with 1 gallon water. And I'm told the most important thing is you got to start with the water, not with the bleach. So pour that 1 gallon of water into the container first. And then pause for the dramatic effect. And then we add the 1/3 cup of disinfectant here, bleach. This gives you a solution that we believe is effective in cleaning your home, cleaning your place of business. It is incumbent on all of us to clean often, and let's not allow any excuse to keep us from being as hygienic as we can. We can do this just about anywhere and everywhere. So thank you, Andrea. She is way overqualified to do that, but we greatly appreciate her. My message at the end of every one of these is the same. We are going to get through this. We are going to be okay. We're going to do it together. We're going to do it by showing each other compassion, but we're going to do it by making the changes that we need to make sure we're protecting especially the most vulnerable. Yes, we have provided some aggressive recommendations, but that's just because here in Kentucky, we love our neighbors, we love our families, and we want to protect them to the best degree that the science is advising us. So with that, we're happy to take questions.
What was the amount of bleach with the water? I was thinking
1/3 of a cup.
1/3 cup.
were talking about the NCAA tournament before and their decision. It appears that the SEC tournament is not following suit as of now. The games are going to continue as
I would
normal.
advise-
Will you advise UK fans not to travel to Nashville?
I would advise that the SEC tournament follow the NCAA tournament in their decision.
And if they don't, would you advise UK fans?
Well,
to
if
stay
they
home?
don't, certainly any fan, I'll say of any team, that is over 60 or falls into the vulnerable population, I would encourage them not to go. As far as others, if you are going to go in a large crowd and expose yourself, you got to make sure then that you practice the type of hygiene to where if you have it and you're asymptomatic, that you're not spreading it to other people. So that's just being very aware of our two duties, which I believe we have: protect ourselves and our families, and then protect other people for us spreading it to them. Because if we're right in that 80% of people are going to be just fine and maybe asymptomatic, then we all have to be very careful.
Same governor go for the Sweet 16 basketball tournament, which is underway in Lexington.
So we just had a call with superintendents and KDE today. I just saw the news on the NCAA tournament before walking in here. I would like to talk to them first, being as connected as they are to our Department of Education. But let me say, of people considering to go to that, certainly 60 and older or falling in those vulnerable populations, my suggestion would be don't go. And then if you do go and you are in large crowds, you just got to take care, practice good hygiene. I'm in large crowds and am going to be as we move forward. It means that I have to be especially careful, along with others, that we practice the type of hygiene where even though there's no reason to believe that we have the coronavirus, we would ensure that we are not spreading it.
You mentioned that one of the tests came back inconclusive. How was that?
So that's a good thing for the person that was being tested there, which means we will do another one. That's actually on one of our individuals that has previously tested positive, and we hope is getting better.
With the,
Well, we know is getting better, but we hope is coming out of it.
with the current tests on hand at the state lab, how many patients can the state lab test for the coronavirus at this point? What's the capability?
So right now, our limitation has been what we get in during the course of a day. So if we get tests in before noon, we can test them that same day, and that has been very helpful. The most that we have gotten on any given day is 20, but I would say it would depend on the patients who that day are seeing their doctors, whether or not they are showing symptoms, the determination that's made between the epidemiologist and those doctors, and that's going to be a day-to-day thing. So today, when we're looking at our tests, that's a good day, and we can be happy that there are no positive tests today. We wouldn't expect that tomorrow. We are going to have more tests.
Does the state lab have the staff to be able to turn tests quickly, and are you guys prepared for a bigger influx of, patient tests coming in?
So our current technology is our limitation in that it has to be done manually. There is technology out there that we hope becomes more widely available that will allow for significantly more testing. The real step is going to be when the private labs truly get up and running, and the date appears to be moving. We hope that it comes as soon as it possibly can, and we anticipate that those private labs will have capabilities eventually beyond us because they already have such infrastructure in place. Chris.
Yeah, Governor, do you know of anyone connected to the LRC or lawmakers or here on the Capitol campus who is now in isolation or concerned that they may come down with coronavirus?
Well, I've only seen, I guess it's from McClatch. I've only seen news that we've got several members of the media that out of an abundance of caution are in self-isolation. For those that are here, you're not showing any symptoms. We don't know that they came directly in contact with people. As long as you are asymptomatic, you're going to be okay. We're all going to be okay. But it's one of these things that we all, from here until when this thing is done, if we got the sniffles, we got a cold, take your temperature, just stay on top of it.
Can you say any more about the patients in Harrison County and how they might be connected?
So the only connection that we've received permission from the individuals that is that two of the patients are connected through their church. but we have found a direct link between all of them and how they would have interacted.
This is a question for Dr. Stack, and I know you've addressed it before, but I think it's important to reiterate for our audience. How long does it take for symptoms to manifest themselves?
Right, so as best we understand, I have to qualify all that, as best we understand, is if you get exposed to it, if you're going to show signs of infection, it will happen within 2 weeks. So it could be a few days, all the way out to probably about 13 days or so. So anywhere from that to 2 weeks.
So theoretically, someone could be walking around for a few days and not
Yes.
even know, yeah.
So just so that the question was clear, I think it's an important one. Thank you. That yes, someone could walk around and have no symptoms and have the infection and potentially be spreading it. The biggest concern, so there's a double-edged sword here. We're very happy to see that children appear to be relatively safe from this. So it's fantastic if you're a parent or a grandparent. The young ones appear to be safe from this. The challenge is they may still be infected. And so you could have healthy appearing but infected individuals spreading disease. And until we can find a better way to understand that and control for it, that's why we have to do steps like we're recommending for social distancing, because we can't be certain where the disease is always present.
I have a question for, well, I guess either.
And all I'd add to that, if I can, is when you look at the significant steps we've taken, it's because people that appear otherwise healthy could be contagious, and that's about protecting everybody out there. Yes, ma'am.
There are people out there saying that the government and the media is overhyping this. They compare it to the flu. You know, can you say something to those people and explain?
Well, I'm a dad of a 9 and a 10-year-old. I'm the son of parents in their 70s. Please don't tell them I told you that. And my job is to protect the people of the Commonwealth. I believe that every step we're taking has been intentional and thoughtful. I know how devastating this can be on the most vulnerable population. My job is to protect people in Kentucky. I don't believe we're overreacting. I do believe we're being aggressive, and I think that that is the right step to take. I'm willing to do what it takes to protect our people. Those are the recommendations we gave today, and I think by the recommendations we've given, you know that we're relying on the science and not just trying to do what will be popular or not. We're doing what we need to do to protect our people. And you see what has happened in other countries with this. If we're aggressive on the front end, then hopefully we don't see those same ramifications. But for anybody who thinks that this isn't dangerous, yes, the flu is dangerous, and it puts it in context. But just look at Seattle and what happened to that senior facility. We cannot let that happen here.
Are there
Morgan.
any tests currently pending at the state lab or any backlog, or are you guys right at this point able to pretty much move them throughout the day and clear it out?
Everything that comes before noon is tested by the end of that day. If it comes in afternoon, it is tested that very next day. So we do not have a backlog. We may have had some kits that came in late today that will be tested tomorrow.
In terms of school closures, will that decision be made at the state level, like ordering schools to close, or is that a county level decision?
The recommendation will come to me from Dr. Stack, and then I will make that recommendation to our superintendents. It'll ultimately be up to them, but it'll be a very strong recommendation, and we hope everybody will follow it. And at some point, we've all got to be doing the same things if we want these steps to be effective.
What was your message? You said you talked to superintendents today.
Yes.
What was your main message to them?
Well, my main message is that we need everybody who is a nerve center to be a leader in this, and to tell people to remain calm, to understand that we are going to have disruptions, but that any decision that we make is for the overall safety, especially of our most vulnerable populations. We had a lot of technical questions that came back, but our superintendents, I mean, they take on their jobs because they love their kids, they love public education. I have no doubt that they won't want to do the right thing. And it's just there'll be different costs that they want us to address. And let me tell you, I'm going to do everything I can under the state of emergency to help all of our public schools that are worried about various costs that be associated with it. General Assembly is moving a bill that would add 10 extra days that don't have to be made up. I strongly encourage them to do that. It is most likely going to be necessary with this coronavirus that we are seeing.
How should homeless shelters approach this situation? Have you had any conversations with people worried about maybe screening of people coming in?
Well, we had actually the first question on that pop up today, and the first thing that we were able to point them to is our business guidance in how you want to look at everything you do on a daily basis and figure out how you work social distancing into it. While there are certainly some challenges in homeless shelters, there are things that you can do if you can pull the beds further apart, if you can have people potentially eat at those beds instead of in communal areas, having more hand sanitizer, requiring people wash their hands before they eat and at certain periods of time. And so we've got amazing people that run each and every one of those facilities. Take the guidance we have right now, be as thoughtful as you possibly can. It takes everybody's leadership, and I know Kentuckians are stepping up to make sure we do what it takes.
Governor, you moved the chairs here.
Yes, we did.
The General Assembly has taken some chairs out of some of their meeting rooms to allow for the space.
We did that through facilities, but they have agreed with it.
Okay, and you've also had the cafeteria closed for eating purposes. Are you contemplating anything else here in the Capitol campus?
Every day, if we have the opportunity to do something that still allows us to continue to function, but helps us cut down on the potential for the spread of coronavirus in this building, we're going to look at it. My goal is to model what we want to see out of other businesses. If we in government are providing the recommendations but not living by them, then people are less likely to follow them. So I think we're going to continue to be thoughtful in how we move forward. It may be something as small as if we've got the hand sanitizer, squirting everybody as they walk into that room or walk out of it too. I can tell you we wipe down the chairs here or trying to after each and every time that people come in, as well as the tables. So we can continue to try to find best practices, and that's a good that is a good exercise for our businesses too, whether it's done through HR when they have it, management, or how about people make recommendations. We ought to be listening to all of it.
Governor, as for the Sweet 16, I know you're watching the situation closely, but how much of a say do you have in it all? I mean, obviously they're their own set of leaders, but how much do you have to say?
At most, we could make a recommendation.
And I think the president's going to address the nation. Some in his administration have taken a different approach than you have with running the state through the situation. What would you recommend that the president say tonight, or what do you think of his response so far?
I'm not watching some of the more political back and forth. We are talking regularly with the federal government. I've been on calls with the vice president, with Secretary Azar and others. We've been getting good information from them. The CDC guidelines that are coming out of the federal government, we agree with. And so I believe that the health professionals that are working on this are all on the same page. And at a time when we've declared a state of emergency, I'm not worried about listening to any of the back and forth. We're just going to do the right things to protect our people.
Are inconclusive tests that the state lab gets, are those being reported on the state website? And if not, do you guys plan to add that for people to let them know how many have come back with that?
I think we will. Yeah, please.
So this is more complex than that. So we're reporting individuals we test.
Right.
Because that's what people care about, is someone positive or someone negative. So if we test an individual, we report the result. But for individuals, initially the protocol was 2 samples per patient. So if we run 2 tests, you don't need to know we ran 2 tests. You just need to know is the one patient positive or negative. So in this instance, the data we report is how many people did we test, not how many tests run, how many people did we test, and what were the results of those tests. That seems to be, that's the actionable information. That's the information that's most helpful for the public to know, to have a sense for how our numbers are relative to other states.
I believe it was yesterday that Vice President Pence said they're hoping to have millions of tests available by the end of the week. Do you know how, if that'll change the capacity here in Kentucky? If we'll have, you said earlier this week, you have about 1,000?
Millions of tests we'd be glad to see. We still might be limited by just the manual feeding that we have to do here. And we keep hearing about when tests will be available. Well, how we have to operate is the reserves that we have and that we can get, along with the CDC guidelines of who can be tested. It also appears that the dates move about when the commercial labs will be up, and so I can't overpromise because we don't have that information. But let me again say that our knowledge on this virus will change dramatically when there is wide-scale testing. And our guess is any new fact we learn will come with positives and negatives. Our job is to adapt to it and to make the very best decisions we can as we go, which is what we're trying to do now.
With the current number of tests that you guys have, how many patients would you be capable of testing total, like with the tests on hand?
With the current, having to manually?
Yeah, so when it's a good question, but when you ask that, I have to think about what the right answer is to give you, because there are laboratories, the academic laboratories, which will probably independently report they're soon able to do the test. So this is very important as you consider how the data changes. In the very near future, places like U of L and UK, our big academic centers, will do their own tests. They'll report the results to us, but we won't get those. There'll be some delay of time. So the data we report will be what we do in the lab. And initially we'll validate some of their tests. And then when we're all confident we're using the same quality tests, then we're going to have to collect that data. So we're going to have to evolve how we report it so we get the true number. And we're giving you immediate data because up till now, we're the only lab running these tests in the state. So that's going to continue to evolve. And I would ask you, as we report these things, you take it in the context we present it. I'm here to give you science. I'm not here to be a politician. I'm here to give you science and to try to tell you what we understand from those tests and how we can use that information to keep people safe. So we'll try to be as clear as we can when the data we're reporting is shifting in its meaning based on how more labs are able to run the tests.
But right now, the state lab is the only one that can.
Yeah, that I'll know better by tomorrow. I think tomorrow will be a better time to give you an update about what the true testing capacity is in other places in the state, as best I can find out.
What's the lab's capacity, I guess, just you guys, if it's just on y'all?
Right, so following the guidelines and having our epidemiologists screen the high-risk patients, we have not hit that capacity. So I haven't had to tax the top end of it, but there's other people out there who wanted tests that didn't get them, so let's be clear. We're testing the highest risk people using CDC criteria and our best judgment with clinicians working with the clinicians treating patients working with our epidemiologists. So we have not hit our capacity yet, but it's not unlimited in this technology. And so we're really looking forward to the partnership with the other labs in the state.
Is there like a specific number, like top capacity equals X number of patients, or does it not really work like that?
I just don't know it because we haven't hit it yet.
Yeah. So our maximum that we have tested in a day is currently 20. And so I think what we're hearing from Dr. Stack is we can do more than 20, but it'll take the experience to tell us how many more than 20 we could do.
Governor or Commissioner, maybe this is a better question for you, and I know neither one of you have a crystal ball that you can look into, but we've gone in 5 days from, hey, this thing is on the horizon, to now maybe people shouldn't have the fans of the basketball tournament, don't go to church. Are we looking at what is it going to take to figure out how long this is going to last? We're looking at 2 weeks? We're looking at 3 months. We've got some pretty big events coming up in the next.
So the coronavirus really was first. I've discussed this novel coronavirus is about 2.5 months old. So there is no clear answer out there about how long we will have to deal with it. What I am convinced is the more aggressive steps we take now, the better our healthcare system will be able to handle this. And I believe the more aggressive we are in mitigating the spread of it, the less long that we will be dealing with it. But to speculate at that amount of time, I think would be a disservice to people out there. We got to expect to be dealing with this for a while and to change our patterns to make sure that we do what it takes to protect other Kentuckians. Now, do I hope that if we take all of these steps that we look at months instead of longer? Yes, I do, but I'm going to prepare for every eventuality.
Is there any consideration or thought process of, under state law, you can delay the election for up to 35 days?
We're just not there yet.
You've asked the superintendents, right, to prepare to potentially have to turn around and close quickly. Do you recommend the same, I guess, for private schools, that they be doing the same and potentially follow suit if, superintendents say, yeah, we're shutting down, private schools should be prepping for the same stuff?
I do. I believe any guidance that we put out that would apply to public schools would apply equally to private schools. All right. Thank you all very much.
Thank you.
Thank you.
Thank you, sir. Thank you.